It is a Medical Monday here on the Morning Blend with answers to health questions from the Carondelet Health Network. If you struggle with obesity, you know that it affects a whole lot more than just your scale. Weight loss is stressful, it's frustrating, but here to talk about some weight loss options to alleviate some of those health problems and improve your life is Dr. Guillermo Higa, and he's the medical director of bariatric surgery at Carondelet St. Mary's Hospital. Great to have you here, doctor.
Thanks for having me.
So let's talk about what obesity is and how it affects your health in so many different ways.
So obesity, Heather, is a problem that affects all the countries in the world, especially the US.
Mm-hmm.
In the US, we have about 40% of the population that is considered obese. And it's associated with a lot of medical problems like type 2 diabetes, high blood pressure, stroke, heart attack.
Mm-hmm.
So there are multiple things that we can do for the treatment of obesity.
Mm-hmm. Go ahead.
One of the different options is medical weight loss, and patients that need to lose more weight would benefit from something like weight loss surgery.
Mm-hmm. And so if somebody is thinking about doing this, who is the perfect candidate?
Anyone will benefit from medical weight loss.
Mm-hmm.
Now, if we talk about surgical weight loss, what we based our criteria is on what we call the body mass index.
Mm-hmm.
The body mass index is a number that we get from dividing the patient's weight and the patient's height. And if this number is higher than 35 and the patient has medical problems,
mm-hmm.
that would be a patient that would benefit from weight loss surgery.
No, what is specific about Carondelet and your approach to weight loss?
At Carondelet, what we have is a combined program.
Mm-hmm.
We have two programs that work all together.
Okay.
We have on one side the medical weight loss program,
mm-hmm.
and on the other side the surgical weight loss program, and we see patients in combination.
Mm-hmm.
The good thing about Carondelet is that we have a team of providers that will see patients most likely for a period of 6 months,
mm-hmm.
and patients are going to have a personalized care and evaluation from all these providers.
How do you know if this is the right approach for you? What questions should you be asking yourself and your doctor?
It's key to know what medical problems the patient has,
mm-hmm.
and also how much weight the patient needs to lose. And depending on those factors, the patient will benefit either from medical weight loss,
mm-hmm.
or from surgical weight loss.
So it just really depends on the person. So there
Correct.
Isn't like a specific, oh, if you weigh 50 pounds or more, it just varies? Is that what you're saying?
Correct.
Okay.
So each patient is different. If someone has type 2 diabetes or problems with their hearts,
mm-hmm.
most likely they will benefit from something like surgical weight loss.
How successful can this be?
If you compare medical weight loss and surgical weight loss, both have different results.
Mm-hmm.
Nobody can be on a diet forever.
Right.
Okay? And everybody has tried diets in the past with no good results.
Mm-hmm.
But sometimes when you are on a diet for a certain amount of time, you're at a plateau, you don't lose enough weight. So those patients get frustrated.
Right. So this specific surgery can help with that in ways other diets can't.
Correct.
Okay. So any complications with this? What should people know getting into it?
Patients, when they lose enough or a lot of weight very rapidly,
mm-hmm.
they can have gallstones, they can have kidney stones. So the most common thing that happens is that patients don't get well hydrated after surgery,
mm-hmm.
or even after medical weight loss. What we suggest to do is to make sure that they drink enough water during the day. And
basic, simple stuff, right?
Yes.
Mm-hmm.
And the amount of water that we suggest to drink is at least 60 ounces of water a day.
Okay. Easy enough after surgery,
yes.
Which makes sense. Real quickly, in the time that we have left, what are some of the transformations that you have seen, not just the physical, but emotional, from some of the patients who choose to do this?
As a bariatric surgeon, it's very great. It's gratifying to see the changes of patients before and after surgery.
Mm-hmm.
So it's amazing to see patients that have multiple medical problems, like most likely the most common that we see and we get great results with is patients that have diabetes.
Mm-hmm.
So we have patients that are diabetics before the surgery, and after the surgery, excuse me, they lose enough weight,
mm-hmm.
and that diabetes gets completely resolved, or
Yes.
we can cut down or
mm-hmm.
significantly on their medications.
Doctor, thank you so much for being here, answering a lot of people's questions. If you would like to check out the Exploring Weight Loss Options seminar, it is happening tomorrow from 5:30 to 6:30 at St. Mary's Hospital. That's in the evening. For more information, you can visit crondelet.org or you can call them at 833-245-1663.